Hello, I am Dr. Mangesh Kamath. I am a consultant hemato-oncologist and bone marrow transplant physician practicing at Helios Cancer and Hematology Clinics, Bangalore. I wish to talk about a very commonly encountered disease by hemato-oncologists like me called multiple myeloma. Multiple myeloma, as the word suggests, is basically the disease of the myeloma or the bone marrow. And multiple basically means that the diseased immunity cells, which are called as plasma cells in multiple myeloma, will attack various organs in our body, such as the kidney, the bone, multiple other organs in the body, and can give rise to the symptoms of multiple myeloma. Usually, multiple myeloma is considered to be a disease of the elderly, most commonly seen in the 6th decade and 7th decade. But nowadays, it is also common to find multiple myeloma occurring in the late 30s, early 40s, and the 50s as well. Now, multiple myeloma, even though is one disease caused by the abnormal cells called as plasma cells, it is not a single entity by itself. Whenever we have a patient with multiple myeloma, we stratify them into standard risk, intermediate risk, and high risk. Basically, the intermediate risk and the high risk multiple myelomas usually require a bone marrow transplantation, which could be autologous or allogenic for long term control or cure of the multiple myeloma. The standard risk multiple myeloma is considered to be a slowly progressing disease which may not require bone marrow transplantation in most instances. So, how do we stratify these patients into these three groups? We stratify them based on multiple investigations that we do when we diagnose multiple myeloma, which starts from the bone marrow testing, the genetic component or the genetic constitution of the plasma cells, that is, cytogenetics of the plasma cells, then the disease burden per se. Is it an extensively spread disease, or has the myeloma involved multiple organs and multiple sites in every organ? And certain other blood investigations are done, such as beta 2 microglobin, albumin, LDH levels. These will help us to stratify multiple myeloma. Once the hemato-oncologist has all this information, then he discusses with the patient about which risk the patient falls into and advises the treatment for myeloma. Generally, the treatment for all multiple myeloma can be clubbed into induction phase, wherein we give chemotherapy at frequent intervals, sometimes twice weekly, sometimes weekly, followed by consolidation therapy with a bone marrow transplantation, which could be autologous or allogenic, depending on the age group, the risk of the multiple myeloma. After the consolidation with a transplant, we tend to suggest the patient to undergo maintenance therapy with certain tablets or injections to make sure that the consolidated benefit of the transplant is maintained over a long period of time. This is how multiple myeloma is treated.